Hey y'all, Dr. Johnson here, your friendly neighborhood medical marijuana doctor. My goodness, we have a jam-packed schedule today. I'm going to try and go over CBDA and maybe a little bit of CBD, but it's a big ball of wax. Yeah, so like THCA, CBDa, or cannabidiolic acid needs heat to be converted to CBD through loss of its carboxyl or acid group. That's the COOH on the molecule. However, CBDA has excellent effects itself and does not need to necessarily be converted to CBD like THCA needs to be converted to THC to do something good for us. I'm all about evidence-based medicine, empirical data. Some studies show that CBDA is more effective than CBD for nausea and anxiety. Another important point about CBDA. Unlike CBD, it does not decrease the binding of THC to CB1 and CB2 receptors. So CBD basically does two things. It allows endogenous cannabinoids like anandamide to compete with the exogenous THC, or the stuff that we eat, vape, drink, smoke. And it does this by inhibiting the enzyme fatty acid amide hydrolase that breaks down our endogenous cannabinoids like anandamide. And so that's just less open areas on those receptors for THC to bind to. And the second thing is that CBD binds to other areas on the CB1 and CB2 receptors that prevent the binding or decrease the binding of THC then to CB1. So last bit of information that's important about CBDA is similar to CBD, it works in a ton of ways, chiefly to reduce your pain and anxiety. So CBDA increases your body's own endocannabinoid, anandamide. It reduces pain through the TRPV1 receptor binding. It inhibits the COX-2 enzyme, which is kind of how the selective NSAID or non-steroidal anti-inflammatory drug celecoxib works. It works in many ways to do a lot more than pain relief too, but we don't have time to go into that never-ending story today. But again, data is showing that it's much more potent in its efficacy than CBD in many regards. Next up, I'll talk about cannabidiol, CBG, which is like the grandmother of the cannabinoids.